Good afternoon. I'm Ashley Furlong, a healthcare reporter at Politico, and I'll be moderating the session on what's arguably the most important issue facing Europe, possibly. Many would agree. There's a lot of talk about climate and health, but we are seeing it now right before our eyes. We have dengue and tiger mosquitoes in Europe. Belgium is even asking you to send pictures of these mosquitoes onto their app. We have fires and flooding affecting people's physical and mental health. There are efforts to change these problems, but often health is not at the heart of those discussions, and our panelists are going to be talking about those issues today. Just a few housekeeping remarks. Please try and engage with us on Swapcard. You can ask questions using the QR code on the screen or follow the instructions on the website. And please talk to us on X or the social media platform of your choice with the hashtag Politico Healthcare. We have a really fantastic panel to discuss this issue today. Next to me, I have Alexandra Kazmierczuk, expert in climate change at the European Environment Agency. We have Tilly Metz, an MEP from the Greens and Vice President of the Sant Committee. And we have Dorothea Beltrux, Research Associate at the Centre for Planetary Health Policy. Alexandra, to start off, I'm wondering if you could explain how climate change and a heating world is expected to dramatically spur on infectious diseases and have direct health impacts on people, particularly in Europe.
Hi, thank you for the invitation. It's great to be here. Maybe I'll just say, because many of you might be wondering, why on earth is the European Environment Agency speaking at the Healthcare Summit? And just to explain that we are a part of the European Climate and Health Observatory, which is an initiative of the European Commission, pulling together the European and international organizations working either on climate change, on health, or on both these issues together. And indeed, climate change, as Alison mentioned, has a lot of implications from human health. Looking specifically at infectious diseases, what we see in Europe is that the changing temperature patterns, the increasing temperatures, the changing precipitation patterns are indeed driving the diseases or the vectors for diseases that have not been encountered before. You mentioned dengue. Indeed, the tiger mosquito is now present across many areas in Europe. And some of you might have read an article about the fumigation in Paris a few weeks ago, where for the first time in the capital of France, there was insecticide being sprayed to protect the health and well-being of people living nearby someone who actually had an active dengue. Also with the endemic diseases, we can see that the diseases carried by ticks, for example, are spreading more northward to higher altitudes, so issues such as tick-borne encephalitis, Lyme disease, and so on are likely to progress in the future. Another thing, warming seas, Vibrio bacteria. There are an increasing number of cases of this flesh-eating bacteria, especially in the Baltic Sea. So there's a lot of examples where we can see how climate change really influences infectious diseases in Europe.
Dorothea, heat and infectious diseases, that's one example of the impact of climate change on health, but your work is looking at the intersection of various climate and environmental threats, whether that's air pollution, climate change, biodiversity loss. And I think one of the challenges is to communicate these sort of overlapping crises to governments and get them to understand that these things are linked. What we might be seeing with air pollution is actually linked to these infectious diseases, is linked to all these issues. How difficult is that work to get governments to actually see those links?
Yes, well, first of all, thank you very much for inviting me. It's a pleasure to be here. Indeed, we're trying to look at all these crises together, and especially at the kind of systematic issues that are affecting them, so the political and the social determinants of them. And I think with climate change and health, we've made a lot of progress. There's a lot of attention at this intersection now, both at the European level, but also in many countries at national level. There are many countries now in Europe that have climate change and health plans. But when it comes to integrating this with other issues, as you say, this can be very difficult. And I understand it because obviously the way that our states work is quite siloed a lot of the time. So you have the Environment Ministry, for example, that will be dealing with, say, air pollution. So these things tend to be in different ministries. And then it's quite difficult sometimes to get this intersection protection, and also to find solutions actually that would tackle these all together. But what we try to say is that there are a lot of solutions that can really tackle the root of all of these crises together. So when we talk about air pollution, when we talk about chemical pollution, biodiversity loss, climate change, we know that there are common sources of all these crises, and we can probably both tackle them together but also have benefits for the health of the population. So when it comes to, for example, changing the way that people eat in a more environmentally friendly way, but also one that benefits their health, you can really have these co-benefits that will help biodiversity, help all the resource use that we have, help climate change. So this is really something that we're trying to emphasize, that there's also a positive outlook. Because right now, I think we're not just destroying the natural resources that we live from, that we need to survive, but it's also not really working for a lot of people's health, and especially those most vulnerable, those who have the least choice in how they live, how they consume, and how they're affected by these vulnerabilities as well.
A lot of those interventions are not always that politically popular. You know, Tilly, I'm sure when you're talking to colleagues, they might be saying, well, you know, I know we need that, but, you know, I'm not going to be elected again if I push that through Parliament. How do you have those discussions?
Yes, of course. There is always talking, especially to the industry. I'm working also on the pharma package, for example. Also, when we talk in agricultural sector regarding agriculture, then of course it always meant, okay, you want us to invest more. There are investment needed. But if we look really the objective, short-term economic objective, yes, it's going to cost something. But at the end of the day, inaction in those environmental criteria, in the concept also of One Health, at the end of the day will cost us more to do nothing regarding the impact on health. We mentioned it because it has impact on the water, on soil, etc. All that was also already mentioned now. And also now we're speaking, we have a law now that is a work in progress that we voted in the Parliament. I'm very happy about it. The Restore Nature Restoration Law, sorry for that. So we're speaking now about we need to restore things, and also when we polluting the water, the air, the impact that it have, all the externalities to make water fit again, to make it that it's water to drink, is going to cost at the end of the day more. And now I'm not even speaking about all the impact also on cost on health of the people. So we have to get out of this short-term economic thinking in order to see it more at the long run or even medium run.
And even though we have, you know, ENVI as one committee, it seems like we still often discuss a lot of these issues as, oh, that's an environment issue, you know, this is a health topic now. You know, and bridging those gaps with colleagues and actually being like, this affects, they affect each other. How does that, you know, how does that happen? And are you able to, do you think it's getting easier as people sort of see the impacts before their eyes?
I must say, honestly, we had now at the European Parliament a special COVID committee about the lessons learned out of the pandemic. And for me, of course, one of the main lessons learned out of it is the fact that we have zoonosis, and that the more we take space, the more we do not respect the animals, also regarding intensive farming, etc., which is really fostering zoonosis and then diseases. I thought, in my naivety, I must say, it would be obvious for everybody that we need to speak more about One Health, that it is all linked, of course, how we treat the animals, how we treat our environment, and then the impact on us. But I must say, honestly, I even had to struggle to have a workshop on the concept of One Health in this specific committee. So, and also to give you another example, on one hand, I'm very happy to be vice chair of the subcommittee Santé, Health in the European Parliament. But on the other hand, we have indeed a committee that is named Environment, Food Safety and Public Health. So there it is important to tackle it all together. So there is a risk if we make a special committee health or subcommittee health that we foster what you mentioned, this silo thinking. So on one hand, I'm happy because it gives more visibility if you have a subcommittee health to a health issue. At the other point, there is a risk to again, as I said, fostering the silo thinking. So we have to, I would have preferred to have one committee specifically, of course, named One Health, so that it is clear that it is linked. Just one last sentence. Also, when we speak about climate change, often we say, okay, we need changement, we need adaptation, mitigation, loss and damages regarding, of course, agriculture issue, transport, and so on. But if you look how much regarding climate change we really invest in adaptation, mitigation, loss and damages regarding health, I think we are about 2%. So it's really, really low that this obvious link is not made. And even if we went through a pandemic, people don't see the direct link often to that, and that we need, of course, to make it a political priority. And of course, yes, that means also investing in it.
Alexandra wants to come in.
Just to maybe add that from what I can see, there is a lot of efforts to bring together closer than subject of climate change and health within the European Commission and the sort of broader European environment. So then the European Climate and Health Observatory, in the lead then DG Health and Food Safety and DG Climate Action, two very separate DGs, and with us the European Environment Agency, we are driving the partnership that also includes the European Disease Prevention and Control Center, European Food Safety Agency, WHO Europe, and so on and so on. Copernicus, which is looking at the remote sense data. So I think that there is a lot of effort at the European level to integrate the two subjects and also bring in other DGs. DG Employment, for example, is quite active looking at the impacts of climate change on the health and productivity of workers in the future. And as Dorothea mentioned, there are examples of this integration at the national level. Examples from Germany and Ireland, for example, where there are specific climate change units being set up within the health ministries to specifically work on this issue. But what we see from the climate adaptation perspective is that the impacts, they tend to be very local. They depend on the specificity of the area and the particular climate challenges. And they are mainly in the remit of the local and subnational authorities. And that's where the biggest gap actually is. That's where the stakeholders from healthcare sector, from social care sector are not really engaged in climate adaptation actions. They tend to be driven by environmental departments, by spatial planning departments. And so we see that the sort of lower down you go in the governance level, the more separated these issues become.
Tilly, did you want to come in there?
Yeah, I just wanted to add, I agree. I mean, in a lot of texts and so on, and also cooperation is being done in order to work on interesting texts, tackling the issue and the links between climate change and health and the idea of One Health. But now we need really to look that we implement also, that we have really a coherent politic. And now even at the EU level, I don't want to, to make you disillusionate, but if we look, we have, for example, the farm to fork strategy, which is a strategy also to respect better the environment, to use less pesticide. But then we have the legislative text on the common agricultural policy, which is not coherent with that. But now it's really the time to be coherent in our politics. So in order really not to have nice text and nice words and nice strategy and nice corporations, now we need also to implement it and to be coherent in our legislative text, and also to implement it locally or nationally and locally, and how we can foster that also, especially as health mainly is done at the very local, national level.
Dorothea wants to come in.
Yeah, maybe just 2 points to add to that. Absolutely right. I think this concept of health in all policies that many of you will be familiar with, that we've been talking about in healthcare policy for a long time. This also has to apply more to environmental and climate policies. So we know that a lot of our health is actually not determined by the health sector. That's where kind of we come to when something goes wrong at the end of the day, but by other policy fields. So what we do in terms of our employment policies, our climate protection policies, all these other fields city planning really matters to our health. And I think for a long time we haven't really kind of looked enough at the health components and how much health is affected by all these other policy fields. And I would argue that's still mostly not the case. It's still often an afterthought or something that's talked about but not really assessed or taken into account properly when policies are designed. And just on the other point, the climate adaptation part, in Germany, we're actually getting a climate adaptation law now. It's actually being negotiated right at this point, and it's a very good example because it was designed by the Environment Ministry, and the focus was very much on infrastructure and on protecting towns and flood defense and so on. And we looked at it and we were like, well, what about the health sector? Surely that's the most important thing. If you talk about a climate adaptation, what are you talking about? We want to stop people from dying unnecessarily. In every heat wave, we have people dying, and they don't need to. We could prevent a lot of that, actually, but we don't because we don't have the policies in place right now. So that surely needs to be the focus. And we have a big campaign at the moment in Germany with all sorts of health and social care organizations lobbying exactly for that, saying, this is a good law and we need it, but it has to work for the health and social care sector. Otherwise, it's not going to do its job. It would be a missed opportunity. And that also means not just saying, oh, we need these climate resilience plans or we need heat protection plans. We do need them, but we also need the resources behind them. Otherwise, if you go to a social care organization, like a care home, and you tell them you need a heat adaptation plan. You need to make sure that the older people who are the most vulnerable population when it comes to heat waves, you need to make sure that they're protected. They're going to tell you, well, we have this to deal with and this to deal with. We don't have resources. We don't have anyone with the expertise. And they're right. So we need to give them the resources and kind of do the job for them in order to be able to protect those people. We can't expect every care home, every hospital to do that by themselves. So I think it's one of those examples where we really need to make sure that the implementation is actually enabled. Otherwise, these plans just lie in the drawer and won't be used, won't be implemented.
I want to ask you, actually, Dorothea, about the pharma strategy. So earlier this year, you authored a paper on sustainability in the pharmaceutical sector, and the premise of that paper really is that the sector needs to ensure that their production of these life-saving products doesn't actually contribute to further climate and environmental pollution. In the pharma legislation proposal, there's a requirement for an environmental risk assessment, and failing that would mean a refusal of a marketing authorization. I'm wondering, is that a good idea?
Yes, maybe just to give a little bit of context, because that's the other point, obviously, that at the moment our healthcare systems also contribute to climate change. In Germany, we don't really assess that systematically, but we reckon it's about 5 to 7% of our national emissions. It's not the biggest sector, but it's significant. And we have our climate goals for the whole country. That means also the healthcare sector has to become climate neutral at some point. And if you look at where emissions actually arise in the health sector, about 2/3 of that, you could say, is supply chains. And a big portion of that is pharmaceuticals. So we have to look at that, no questions. That's a big part of the problem. And I know a lot of the pharmaceutical companies are also looking at it, but some of that has to be dealt with at legislative level. And there are many different routes to do that, many different aspects that you could look at. But the environmental risk assessment is one of them. Obviously, we've had the environmental risk assessment for medicines for human consumption since 2006, but at the moment, it's not really significant in the authorization. So if a drug is harming the environment significantly, that doesn't really matter for authorization. And now you could argue, well, surely that's right, because the most important thing is that it benefits human health, right? Now, we think that the environmental risk assessment is important to strengthen that, to make it relevant. It's not because we want fewer drugs on the market, of course not. The point is that it should become mandatory to reduce the environmental harms in the production and then have it authorized in a more sustainable way. So the goal is not to have fewer drugs. That's not the point at all. It's to make sure that they don't harm human health in a different way, either in the production countries or through other means. And at the moment, that's doing that. And surely that can't be right. Nobody can think that's how a system should work. So I personally think this is a very good development. I very much hope this is coming through. It's not going to solve all of our problems with pharmaceuticals polluting the environment and having a carbon footprint, but I think it's gonna level the playing field for companies wanting to sell on the European market to say, okay, you also need to reduce this. And we're not just doing that for drugs, obviously. We're doing that through the supply chain legislation for other companies as well. And this is one thing we have to deal with. That there's no way around it. Otherwise, it's going to harm us one way or another sooner or later.
There's obviously been pushback against it, and we've seen the draft directive report in the Parliament where they've stopped that linkage between you fail the environmental risk assessment, you don't get it marketing authorization. Tilly, how are you going to be pushing in the coming months in these negotiations?
Yeah, I think, to be honest, we Greens really push also for it to have this aspect be considered also in the pharma package. So I totally agree. I think it's an important step forward to consider also the environment and to make the environmental risk assessment not just something nice to have, but really to make it mandatory. But I'll be also very, very honest. I mean, yes, if we produce medication, that has an impact, but it is also to push to look for alternatives, to ask the pharma industry or to look for alternatives if something is really harming the environment and then also the health again of humans. And on the other hand, if we cannot find an alternative, but then at least at strong levels, what would be allowed then to come in the environment and what not. And it's not only to look at the production chain, it's also how we treat the medication when it cannot be used anymore, regarding waste, etc. So how we deal with it. So we also need there a very complete approach. And what's more, like, we have to give us also the tools to measure this environmental risk assessment. I'm working also on the file on train, where there are also for the allocation of lines, for example, there is also the socioeconomic and environmental criteria that must be respected. Also there, we have to give us the concrete tools to measure that. And now in a time when we're speaking of a silent pandemic of antimicrobial resistance, I mean, if we do not tackle it, we even foster this pandemic, which is, people say it's a silent pandemic. I don't know why we say it is there, it is reality. So we need to tackle it. We cannot just say, oh no, that is going to be too complicated. But on the other hand, and also there, completely agree with you, we have to guarantee that medication comes on the market, that new antibiotics come on the market. So it's really to balance and also to be honest about that. Yes, we want this medication, but we know it has a certain impact. How do we tackle? How do we adapt? How do we mitigate? How do we try to make the impact on the environment and at the end of the day on the health of the humans, of the ecosystem, as low as possible?
We also have the wastewater treatment rules that are potentially going to require pharmaceutical companies to help pay for the treatment of this water. Companies are saying, well, you know, we actually can't afford that. We might shut down the factory in Europe, you know, which no one wants. And I think that it's a very difficult balance to find. And I'm wondering, you know, how do you find that balance when you are presenting sort of the risks to policymakers and as well as the costs that they're going to come with? Alexandra, I'm wondering how you communicate the science behind it, and then also obviously the potential costs to industry.
Well, and I think in the case of many of the measures in terms of adapting to climate change, as Tilly mentioned, we have very advanced planning. We don't have so much implementation. And it's a bit of a chicken and egg situation. We don't have a lot of implementation because we are not quite sure what is the most cost-effective, what is the most cost-efficient, what works the best. And for many actors, both in the private sector but also in the public sector, the investment needs to be based on a solid evidence that wherever the money goes, it will actually do the right job and be the most cost-effective measure. So what we really need is, on one hand, strengthen the implementation of measures, but on the other hand, the monitoring and evaluation of what works. And then with this evidence, it's much easier to persuade any actors, both in the private and in the public sphere, to actually do these things. But do we start from implementing more and treating it as a living lab and learning from that, or do we need more research first when we should be acting now already? That's a big question.
And Dorothea, you also obviously, have that sort of role, especially in Germany, particularly. I'm wondering how you engage in those conversations.
I mean, I think obviously it's important to kind of make sure you get a balance between presenting the facts and sort of the problem at hand, and then coming up with different solutions, and also saying what would be the alternative. So, say with the water treatment, at the moment we don't have the technology in place, at least in Germany, to filter out a lot of the medical residues in the water. Now you can say, well, it doesn't harm human health directly, right? It's absolutely fine to drink the water in Germany, but it harms ecosystems, and we don't completely know how it affects ecosystems and then us in the long term. So that's the current status quo. And if you say, okay, pharmaceutical companies shouldn't pay for it because that would put an additional burden on them, it would be a disincentive for them to produce in Germany. Well, who else pays for it? The taxpayer. That's also a hard sell for politicians, right? Water treatment costs have been going up, and they will continue to do so as we get more and more problems with our water treatment as climate change and all of these pollutants increase. We haven't talked about chemical pollution in general yet. That's a whole other issue also for the health sector that we should be very aware of. So surely there's a compromise possible with the pharmaceutical industry and having the taxpayer pay for some of it. And also can be an incentive. I think if you put a price on it, if you price on these externalities, hopefully it's not just going to mean we keep doing the same thing and just have to pay for it more, but it should be an incentive to produce drugs in a more environmentally friendly way and say we have to find solutions to avoid all these medical residues to come into our water. That should be the goal, obviously. The goal is not to just make the whole system more expensive. It's to actually have the right incentives in place. And at the moment, they're not. At the moment, we have these externalities mainly paid for by the taxpayer and by the health of our most vulnerable citizens.
Tilly, what do you think the role of industry is here? Should they be contributing to this?
Should they be?
Contributing to this cost? Should they be paying for it?
I mean, you know that I'm, or maybe for some who know me a little bit, I'm really fighting for more transparency on the coast that is really needed to develop medication. And we know that a lot of the pharma industries did a lot of benefits during this whole pandemic. And so I'm completely okay, we're saying, okay, we help to pay also to support ecological transition, but for that we need transparency on the coast, and that a lot of pharma industry does not necessarily want to do, because in my spirit it's also polluter payer. I mean, if it's clear that you are causing pollution, and especially if there are alternatives, I mean, you have also to pay for it. And I have a little bit of problem that we say generally the taxpayer has to pay. I mean, if we look at the patients that give often already their data in order that the medication can be developed, etc., if we put public money in the development of a medication, of a vaccine, somehow there has to be also a return in invest. And for me, the return in invest is make medication accessible, affordable, but also caring about the environment. So that's part of it. So. If I may just say something else on the political level, at the first time I was happy about to hear that the COP28 is now making a day for health. One day. That is really tackling the health. And then I'm reading, but they are not really considering the elephant in the room. And the elephant in the room is fossil energy. And it's that the fossil fuels that the fossil energy that is really harming the health of the people, and it's not really tackled, that we need to phase out there to take it really at the roots. And on the other hand, we are still living in the global trend to not reinforce public healthcare system, but reinforcing public healthcare system is also part of adaptation and mitigation regarding the impacts of climate change on the people. That was just a little bracket I wanted to place somewhere. Sorry for that, but it's out, it's better.
Earlier, the topic of sort of the most marginalized people, the most vulnerable people being affected by these impacts by fires, by flooding, by these infectious diseases rising. Alexandra, can you explain why that's the case? Like why does that happen? Can you explain, and then we can get on to some of the how we tackle it.
And when we look at the climate impacts on people's health, there are three important factors, really. The first one is what is happening. It's a heat wave or a flooding or wildfire. The second thing is where people are. How are they exposed to this risk? Are they living in a floodplain? Are they living close to wildfire-prone areas? Are they living in a house that is impossible to keep cool during the heat wave? So that's the exposure factor. And the third thing is it's the vulnerability that is associated with the person's age and health. So we see not only with heat waves that it's the most, the oldest and the most frail in the society that are dying. We can see that it's usually children that are playing in water that might not be completely clean, that are contracting the infectious diseases. And we see migrants dying in a wildfire in Greece, the most marginalized probably group of people in Europe. So people are affected by who they are and where they are and what is happening. One thing I wanted to mention that maybe it's a bit of another silent issue. It's the climate change impacts on mental health. Mm-hmm. That is not just the physical health that matters, it's the mental health. And for example, in the case of extreme weather events, it's some studies estimate that it could be 40 times as many people suffering from mental health implications than the actual physical injuries. So it's a huge number of people that is affected, but also people are affected by heat waves. If they're on any medication for mental health issues, it might be affecting their physical health as well. And also another vulnerable group, children and young people. There is a terrible rate of people who are really uncertain about their future, who are frightened for their future, and very rightly so, because all the climate projections are showing that the world will not be livable in the decades to come. So they are the people who are having a very heavy burden on their very young shoulders, and that's a sort of silent mental health epidemic that might be developing further in the future.
And Tilly, those people are not necessarily, children can't even vote. So, how do you, when you speaking to colleagues and when you're trying to have those discussions, these are not necessarily the groups that politicians care the most about. How do how do politicians handle that, and how do you start to ensure that they actually do care about it?
Yeah, I must say, even everywhere in Europe now, we have also consequences of climate change, like floodings, like droughts, everywhere. Even I'm coming from Luxembourg, even in Luxembourg. So, and those who are suffering the most from that are those vulnerable population, especially women also, and pregnant women, and also elderly women, and etc. So I think by very concrete examples that people have now everywhere in front of their door, that they can be also victim of that, brings it, of course, closer to the people, but also saying at the same time, there are solutions. We have now the technologies, we have the knowledge. We know that this climate change and there's consequences, etc., is because of human action. So I think it's important also to say to people, it's just a thing of political priority, political will, and we need to implement that. And it's not about, I'm very happy that you mentioned the thing of the mental health issue. We have also there, we're speaking more and more about mental health strategy, roadmap that we need to do, and especially for young people. I mean, it's crazy what we ask today from young people, not only the whole pandemic, but also when I look this whole movement amongst the young people, that they are afraid, that they are worried, and that they feel that politicians are not acting. But I think it's very important to say, but you have it also. You can push pressure. The citizens have power to make the change together with the media also.
Dorothea, do you want to come in here before we wrap up?
Yeah, so maybe just one thing to mention. I mean, a lot has been said. I think one thing to keep in mind with this is also that climate change can actually exacerbate poverty and inequalities and inequities in our societies. So if we just let climate change run, that will definitely be the case. And it's because it's increasing poor health for the most marginalized in our communities. We know poverty is the biggest health risk, and it's been for a long time. And on the other hand, also poor health is also a poverty risk. So I think we need really strong policies to tackle that, and also to tackle these inequalities and inequities in our societies. And we know at the moment it's going the other way, right? We have a lot of people really struggling to make ends meet, and that also affects their health. So I think it's important that climate policies take this into account, both the social justice and the equity issues, and on the other hand also that we generally look at how we can stop this trend towards more inequality. And maybe one last sentence, because I think we focus a lot on this within Europe, but also we have to keep in mind that most of the harm we cause with climate change is in other countries, and for people who are much more affected by climate change, have much weaker health systems or social support systems to support them. So that's always something that we need to also think about. What is the harm that we're causing elsewhere, and who are the most marginalized people there?
Thank you so much to our panelists. It's a really critical issue, and I think that one that's going to obviously continue to rise in prominence as the climate crisis worsens. So one that everyone will be focused on in the coming years, hopefully. Please remain seated for our interview with the Belgian Deputy Prime Minister, Frank van den Broeke, moderated by Carlo Martuscelli. Thank you very much.